its establishment in 1957, Port Moresby General Hospital has evolved its journey in delivering the healthcare service for more than 50 years. Port Moresby General Hospital continues to provide primary and secondary healthcare and at the same time performing its role under the National Health Plan as the National Tertiary Referral Research and Teaching Hospital. The present facilities setup of the Port Moresby General Hospital was the establishment of 2 colleges in the 1950s and 1960s, according to Professor Keval, who was a medical student at the time.
We started off here as on this side. This was the native hospital, and on that side we had Ward 1, which was obstetrics and gynecology in the 1950s and 1960s, ONG. And then after that, the next ward was called Ward 2, which was the pediatrics ward. And then the next ward was called surgery, and Ward 4 was medicine, and Ward 5 was TB, and Ward 6 was psychiatric ward. So that's the way things evolved now. But then later on, we've gone into specialization.
The first college was called the Papuan Medical College, and the second was called the Administrative College. The idea of setting up 2 colleges was to train the medical health workers and the administration workers. The 2 hospitals were also set up, the first being the Native Hospital, called the Walter Strong Wing, and the second, the White Man Hospital, called the McGregor. Professor Keval is the first physician in internal medicine and is currently working as a cardiologist specialist at the Port Moresby General Hospital Clinical Services.
The relationship between the hospital and the university was so important that it was realized that if you want to become a specialist as a physician or surgeon or an obstetrician or pediatrician or whatever, then you have to pass another exam. That degree is called a Master of Medicine. So you do have Master of Medicine in Internal Medicine, which is where I come in, Master of Medicine in Surgery, which is where my brother Ikao went to, Associate Professor Ikao Keva, and then we got Master of Medicine in Obstetrics, which is where Professor Glenn Moller comes in, and Master of Medicine in Child Health or Pediatric, which is where Professor John Vince and Professor John Bidard used to come in. So that's the way things have evolved over the years. Well, PMGH has done very well. Like I said, struggling from the time when we were called the Native Hospital, and our facilities, our investigative facilities were very limited at that time, and there were lots of infectious diseases. And by the way, the infectious disease, largely tuberculosis and HIV/AIDS, and then pneumonia and all of those, malaria. So the infectious diseases have been there for a long time, but with the lifestyle disease coming in after independence, because of the change in lifestyle, because of the change in the foods that we eat with lots of cholesterol or fatty stuff, then the diseases like high fat levels in the blood called lipidemia, blocking the blood vessels, the diseases that affect the pancreas, causing diabetes and all of those. As they've come in, then I see all of those coming in. So that's right. Yeah.
Many trained doctors and administrative workers over the decades have graduated from these institutions, and many have gone on to work in different departments of Port Moresby General Hospital. To run any large institution, you need a team of people to organize and help each department to work together to reach their daily goals.
After completing my studies, I continue with as a casual with PMGH, and then in 1997 I was confirmed to a position with the Director of Medical Services, which I am currently under. All these departments, I deal with them every day, doing the correspondences like letters and requests any other things that are needed in the department. So that's like everyday thing that we do. It's very challenging because it's 20 departments and they all come under medical services. And what really motivates me to work all these years with PMGH is the services provided, working as a health worker, helping out our people, especially working with doctors, getting to know them and working with them. It's like it has motivated me a lot. And also the training that I have been taking, I thank PMGH for supporting me in training. As I can remember when I started work, I was using typewriters. I didn't have any knowledge about computers. So PMGH sponsored me to do computer training. It is a privilege working with PMGH.
After many decades, Port Moresby General Hospital has seen an increase in lifestyle diseases, which has led the hospital to invest in research, training, and projects under specialized care. This has led to the hospital evolving over the years.
We had lots of challenges that we were working at a place with very little investigative facilities, and those challenges are now being not quite overcome, but they're still there. But you know, the fact that we can do scans and look at the brain now. So you can do a CT scan of the brain, and then when somebody has a stroke, and there is in those days we couldn't tell what was going on inside the brain. So, but with the evolution of the scanning system, the brain scans now make us diagnose that there is a lump in the brain, or there is a bleeding in the brain, or there's an area of the brain which is not. Which is looking dead because its blood supply has been stopped. So all of those, and so then we correlated with our physical findings. So if someone's got a stroke on the left side, on the left brain, then the right side of the body is weak, and also if somebody's got a stroke affecting the right side of the brain, the left side of the body is weak. So that's called hemiplegia. And then they can also tell from the scan whether it's a bleeding, or it's a blockage, or there is a tumor, or there's a TB, or whatever. So all of those are. So those are the things that we couldn't do before. But once the scan situations come in, we are now in a much better position to make those diagnoses. And also the challenges are for the X-ray department to evolve, and they do all those scans and all of those. And the pathology department has also evolved over from the simple, straightforward full body examination, malaria parasite testing, to now many other things. So the whole of Papua New Guinea has seen those changes coming in, and with those changes, they help us, the physicians and the surgeons who make our diagnosis on clinical examination, the confirmation by the scans, the confirmation by high-powered blood tests, and all of those are. So they're all very important.
At the Sir Burikido Heart Institute, as Professor Isikevo has stated, heart machines are used as a non-invasive procedure, whilst invasive procedures involve a surgical approach. At Port Moresby General Hospital, they have a catheterization laboratory, which is a specialized medical facility used for diagnostic and interventional procedures involving the heart and blood vessels, which was not available in Papua New Guinea in the past.
I am Dr. Wesong Boko. I am originally from Finch in Moresby province. I actually started off as a general physician, then along the way my plan and desire changed to become a cardiologist. So I trained in Singapore I did a fellow in clinical cardiology as well as intervention cardiology from 2013 to 2016, and since 2016 up until now I returned and based here in Port Moresby and been the head of this cath lab here, this cardiology here. I've been practicing as an intervention cardiologist since 2016. Yeah. Okay, when we started off here, Port Moresby General Hospital is one of the main referral hospital, if you like, the big hospital in the city. There are a few hospitals, but they haven't come up to that status where hospital. It's more like a big urban clinic. And hospital tend to take care of almost everything, primary disease, and as well as embarking on the specialist care. And I started in 2016, 17, 18 when we have this cath lab up, plus the other discipline who are also going into specialized area. But I thank God that cath lab or cardiac has really taken off. And we have actually established this cath lab. And now we can do coronary angiogram, we can do stenting, we can do other structural device close-ups, which you will, before this, you will have to have those services or those treatment in Australia or in Philippines or in Singapore. But we are having it right here. And even apart from cath lab, we've seen the kidney, the renal, have really improved in Port Moresby General Hospital, so that's a big plus. Also the neuro in cardiac, I mean in surgical department, and the other disciplines actually have rise up and began to take that part of going into highly specialized, just like cardiology. So it has really improved since we started off. Port Moresby General Hospital is not only providing the general service, but it has really gone into specialized, and maybe in the next 5-10 years we will see more specialized service provided here. Well, one thing that inspired me firstly to be a cardiologist was not my wish, but seeing the lifestyle disease and the number of people who are coming with heart attack, and almost 99% of those patients will be waiting to die. Only 0.1 or 0.1% who have got the money go overseas. So while training for my clinical echocardiology in Singapore, that's the reason why I went to Singapore. But while there, coming back and seeing the statistics that almost every day there's heart attack coming in. And many of those heart attacks, we just treat them, give them medicine, thrombolysis, and then eventually they go on conservative medicine, and whenever complication become worse, heart failure, they die. So those are the things that motivate me to begin to, after my clinical echo, within me I started to say that if I don't, at least there's an opportunity to put up a cath lab in Papua New Guinea. If I don't do it, then nobody will do it. What I can say to Papua New Guinea, if you are listening to me, is that with regard to heart treatment, we can now provide the treatment in terms of doing angiogram and stenting. What you can actually see in Australia or in Singapore, Philippines, we can do here. So I think that the only issue will be for you to get to Port Moresby and come in and see us to do. We not only doing that, but we are also doing those patients with holes in the heart, like atrial septal defect, what we call ASD or VSD, and PDA. These are congenital problems. All this time, the team from Australia has been helping us to close some of them, but now we can also do in these facilities. And also, if you have problems with your heart rhythm and your battery is not working well, we can also put in the battery in here. And just recently, we started to help people who with stroke. Stroke is a big problem. So if you have stroke and you are presenting to these facilities within 2-3 hours, we can able to go in and remove the blood clot in the brain, and you can walk. And we just did the first case just before the independence. So it was actually a pioneer and groundbreaking history in the making that was. And we are also doing almost if you have any mass like cancer in any way, any part of the body, and if surgeons want us to go in and help them to shut down the blood supply and shrink the cancer so that the operation will be quite good, smooth, and not as worse or messy if you got a lot of blood supply, we are also doing that. So if you like, we're doing many things in this place. So Papua New Guinea, if you listen, you can come. Our greatest challenge to provide the service to the fullest is the funding and the consumable. That has been the biggest obstacle. But at this juncture, I also want to thank the Port Moresby General Hospital, CEO Paki Molumi, and the SCM, the board, and the Kumul Petroleum through the government of PNG, government of Marape, Rosso. They have been very supportive, and we hope and pray that that support will continue so that this highly specialized, because if any Papua New Guinean you want to go and get the same treatment like what we provide here in overseas, it will be very, very expensive. And what you pay here is almost nothing compared with what you're gonna pay. Like one stent in here, you are looking at paying maybe 11,000. If you go overseas, you're looking at 150,000 and above. And it's so huge. With the kina begin to lose, and that's how much it is. So our service here is really depend on how the funding from the government and the support will be. So we will provide everything that the cardiac need, but the challenge is the support, and we'll continue. So if you got all these heart issues, please do drop by. We have a clinic down here. We do echo, we do ECG, Holter, and then eventually if you want to have you come in here for coronary angiogram, you come in here for that. So it's almost like a one-stop shop.
I had this my heart issue over many years. Went back and forth at Form 10, seeing the cardiac team, and they helped me and guided me through. And to a point where I think 2 years ago, they advised me that my aortic valve is getting smaller, blocked, and I could not live any longer. So they encouraged me to get overseas treatment. But I couldn't do it because I had no money. Then I came back again and they saw them this year. And they checked that the complications of my aortic valve is getting worse. And doctors, they felt very sorry for me too. And then the 2 times they put my name to open heart operation team, but they rejected because my condition was such that it was very risky. Then Dr. Boko went out on his own way and talked to the CEO of Form 10 and others. They gave them best to arrange a possible alternative to get help, to help me to correct the problem aortic valve. Everything that they did was successful. And before I went for operation, Dr. Boko and his cardiac team, they told us about the risk involved in that procedure. We had the risk factors, but then we couldn't do much. We all agreed that I had to go through this procedure with the help of God. We prayed, and God gave us the boldness we say, yes, let me go through the operation. And we signed the consent papers, the families and myself. And then after that, immediately they took me into the theater, and they replaced the new aortic valve to correct my problem aortic valve. I'm feeling better. I'm breathing okay, walking okay, talking okay, eating okay, sleeping okay, no difficulty in breathing, no headache or dizziness, no problem. I'm really thankful and blessed to see this day. Otherwise, I would not live. Thank God. I'm a happy person, and I'm really proud to present myself to the people of Papua New Guinea. I know there are many others who may have a similar condition as myself. I encourage them to come to Phom Sen. They will get the help, the best help they can offer. Our doctors are more than qualified.
In all medical and clinical services, nurses work closely with the doctors. Sister Elizabeth Carew is the cath lab unit nurse manager, and she shares her experience working in the cath lab.
In the cath lab, before they go in for procedures, they normally come through the KPHL cardiac clinic, that's diagnostic center, where they come through, especially if they are referrals coming in from other provinces. Within PMGH, when they come through the emergency department, they are brought directly up from the emergency department to cath lab. When they are referrals from PIH, they call us before the patient comes in, so the patient comes directly from PIH or Paradise Private, that's from the private hospitals, directly to cath lab. It's only the referrals that come from the outside, they come through the cardiac clinic and they come up to us. We attend to them by their letters that they come in with. So we have cases like we do their investigations, like their blood reports, and then we bring them in to cath lab. They don't go directly in. Once they come into cath lab, we also do their pre-operation observations, which is like doing their vital observations. If they need their pre-medications, we give them their pre-medications, and we also do catheterization, like if they need to have an IDC, we put them in IV fluids, and we send them into the lab for the procedure itself.
So once they're done with the procedure,
they come out to us again. And this area is where we take care of them. So we keep them here for 24 hours or 48 hours for angiograms. And those who are like more than angiograms, who have a blockage and they have a stent put in, they stay for like 3 days to a week. And then they get discharged and go home on medications. From the cath lab, they come out, stay in the wards for like about 3 to 5 days. Like I said, it's for patients who already have stents put in. And those who are only for the diagnostic one, which is angiogram, they go home after 24 hours or 48 hours. They go home. My motivation was that I was seeing new things happening in the hospital, and I also have a mentor who was with me, and she was like seeing beyond the horizon what is to come. So she has been mentoring not only me, there are others who were with me that she was mentoring. So it kept me going, knowing that new things, new services would come up in PMGH. So I kept on, working and moving along with the changes that were coming.
Port Moresby General Hospital has led a long history of organizing open heart surgeries in the past. For more than 30 years, the cardiac and heart services have developed and evolved in its operations.
Yeah, so I'm Dr. Noah Tapawa. I'm a cardiothoracic surgeon for this hospital. Yeah, so in my previous role as a surgical coordinator, I think we were able to establish 2 new units, the plastic team and one of the orthopedic team into the surgical specialty services. As a cardiac surgeon, I think we've come a long way. Cardiac surgery in Papua New Guinea started way back in 1993, and up to now it's about 32 years. And a lot of development that occurred over the years. Us establishing this cath lab, and through the funding from KPHL, we were able to renovate our ward and also our clinic. So those are some of the new development that I was also part of the team that we discussed and with the management we put together. Yeah. So as a cardiac team, it takes a long time to train it because it comprises of various specialties, the nursing specialties, and both in the ward and the operating theater, and also you have to have a perfusionist team, anesthetic team, and of course the surgical team. So it took a while for us to put this team together, but I'm very thankful for the Australian team who's been coming through the Operation Open Heart International and also Singapore National Heart Center. And with the Singapore National Heart Center, they've assisted us to train our core team. So there were a few of us who went for training. There's 4 of us doctors and the first 6 nurses that we went there, stayed in Singapore. And then we came back, all of us came back in 2015. And then we started working together as a team. Yeah, so that's, if you like, and like over the years, we started to building a team, core team. The team from Australia and Singapore continued to come, but we started to reduce the number while we are building our capacity and increasing our staff strength as well. Yeah. Yes, so closed heart is the surgery that we do. We don't stop the heart still, continue to pump. Whereas the open heart surgery, we have to stop the heart. So the closed heart program, which involve us operating outside the heart, and these are congenital conditions like patent ductus arteriosus. We call it a PDA. Yeah. So we just open the chest and go in and close the defect. This is an abnormal connection between the heart and the major vessel. Also involved in the closed heart procedures are like pacemakers that we've been doing as well. And apart from that, we do general thoracic stuff as well, including the lung and the esophagus that we operate on. Initially, when we started the open heart closed heart program, we took over this in 2004 from the visiting team, and we slowly built it up. So we would do, say, maybe 4 cases at least in a month. Now we've increased that. So like now we are doing 1 or 2 cases every week. And pacemakers too, they come in, as they come in, we do them. So these are some of the functions we've taken over from the visiting team, and with that confidence and the skills that has been transferred across to our team, that we are now able to do it. Yeah. Yes, the number the team used to come, because they will come with the whole specialist, including the nurses, perfusionists, intensive care, the anesthetist, and even the surgeons. So up to about 60 member team that they used to come, and we would do like 2 visits in a year. So over the years, as soon as in 2015 when the team came back, we started to building our own local team, and then we cut it down from 60, we came down to about 40, 30, to 22, and now only 8. So every visit now, and we are doing frequent visits, so like in 1 year we are doing 3 to 4 visits, and also only a few member team that comes. While our team now, the local team has grown up to about 42 members here.
The Kumul Petroleum Cardiac Diagnostic Center at Port Moresby General Hospital receives patients in Port Moresby and across the country. The Heart Center has been upgraded and equipped with advanced cardiac equipment funded by Kumul Petroleum Holdings Limited. Sister Noelin Wangi is the nurse manager of the center, and she shares how the center operates.
That time in 2022 April 12, it was officially open. So we started getting coronary cases like adult cardiology and patients. We started getting it on the 19th. That was the first patients that came in through this clinic, Kumul Petroleum National Heart Center. The clinic itself, it was like operating with starting on the 19th. So Dr. Boko and Malan, they will start seeing patients for the procedures and all this for coronary angiogram and coronary angioplasty. So, and then on the 19th, it was the time that it started, we were running the clinic. It was open now for the patients. So we are getting referrals. The pathway is like we are getting referrals from outside, from the province as well. So we are getting referrals. We are getting initial consults within the hospital. Those are patients that they are seeing doctors, and then we have the review patients that we have, and then they are going and coming and see doctors like every after their clinic days. Okay. Per clinic patients day, we have cardiac different specialty. We have the coronary patients, adult cardiology, that's under Dr. Boko and Malan. And then we have cardiothoracic patients, surgery. We have Dr. Tapawa, patients under Dr. Tapawa. We have pediatric cardiology, that's under Dr. Kilalang. We have echo patients. They come in for echo only, so it's especially on Thursdays and Tuesdays. So Dr. Olitai and Dr. Kiromat, they usually come and do echoes. On Wednesday, it's Dr. Boko and Malan, they run the clinic, and Tuesday, Dr. Topawa and the team. As we started, the number was like smaller, and then we start getting like so many patients are coming up. And currently now we are like seeing 60 to 70 patients per clinic day on a Wednesday only. That's under Dr. Boko's patient. Adult cardiology patients, that coronary cases. So for them it's like, it's so many patients. So our maximum number that we have cut off, required number for the clinic is 50. But we are seeing that we can send a patient, so they need help and they need to see a doctor. So like, we have to get that number that we are getting it now. But because of now we are seeing that we have been overbooking and, keeping patients outside waiting in the sun and all this, it's not look good to our service that we are providing. So we are trying to cut down the numbers to as required as 50. But as I said, the numbers has been just going up. When I came, I started myself, I was given 2 nurses to come with me. So we were 3 running the clinic that time. We started with 3. And we still remain as 3. So the problem that we are facing now, it's tough. Manpower is required here because the number of patients are just increasing. Patients are increasing. It's like we are looking at 60 to 70 patients per Wednesdays. That's for the coronary cases. So that's the 2 only challenges that I face. Well, as we are going through, like now it's 2025, now I'm seeing it. For the number of patients we have, our required for the clinic is 30, but we are just increasing the number to 50. We consider the referrals from outside. So we don't want them to come and wait around here. It's Port Moresby, they're traveling from outside. They're coming on the plane. So we are give them the priority. So we put them within that 30 to make up to 50. We advise them to go to the nearest like Kero Hospital or go to 6 Mile. And then not to the small clinics or any private clinics. But private clinics that we have, we advise them to go to Paradise and PIH. And for the other small clinics around, we don't accept those ones. If they come with that referral, we will still tell them to go to emergency. We always refer those patients there. As long as they come with a referral, it must be addressed to that referral letter to interventional cardiologist must be addressed to Dr. Boko and Malan. So these are the patients that we accept through the clinic, yes. So my advice to people, you take care of how your diet. Diet is very important. Take care of your health, your diet. Do some exercise, you go around. Do some activities like you walk around and all this. And the other thing, your diet, meaning like if you're a smoker, you have to, in a long run, it's bad for your health. Smoker, alcohol, and betel nut. Now it's like for the currently findings now, these are the main causes to like high blood pressure and diabetes and all this. So in your diet and your lifestyle, you have to control all this. And in your diet as well, you have to control your intake in taking salt, the protein that you eat. Don't eat so much of the processed food. These are now just like, it's not good for our health as well. So.
Name Teresa Capera. Pequeña Blomi and Galina Capera. Last week Friday, we come here almost General Hospital, Kimbe, referring me like further treatment from Belinda, and we got aromatic heart disease. So, we took a Dr. Ilukime, Dr. Malia. So like my message to the parents that their children are going through aromatic heart disease, someone look and give up. Only must go to house sick, looking at doctor, kiss him, help him. We may not can give up. But what the important something and me like him, say me must get kind of facility also. Like all specialists of heart disease. So you must get clinic blood stop looking there by good blood. So now you look at me to plan. Me plus stop now. Papa must have me plus base looking there. So but Dr. Marley talk by every year by me plus I travel, you come inside. Come to walk him check up looking. So you look at me more like expensive exercise. So suppose me like that kind of clinical assembly heart disease stop looking them a good plan. We all get that everyone will benefit. With this new blood disease come up here, aromatic heart disease here, by helping planting.
The heart is indeed a complex and precious organ, and seeking a cure comes with a great price. This has been the exact case for many kidney patients in Papua New Guinea. In 2025, Port Moresby General Hospital made its first ever kidney transplant surgery as a step towards a more accessible and cost-effective solution for kidney patients.
Okay, so kidney transplant has come about as a policy statement done by our Prime Minister. He wanted us that health services must be accessible to all Papua New Guineans, and Papua New Guineans must stop traveling overseas. So this kidney transplant coming to that stage, it started as a dream of two doctors. I would like to appreciate and acknowledge them at this time. That's Dr. Stephen Bogosia and Dr. Damien Hasola. So they've widely worked with kidney patients, they've trained, and when we came back and they worked here, they've seen that it costs a lot of Papua New Guineans money. If you have to go overseas, I'll just give the approximate figure, you would spend around 1.5 million kina to get a kidney transplant overseas in Manila, be it Singapore or India, and it's quite expensive. So we need to close that gap to save our people, to have them access this service in country. You know, we've been developed for the last 50 years. Why not we bring them? We have specialist doctors who are trained overseas. So why not we do it here? So when we saw that there was an increase in kidney patients and kidney diseases, these two doctors said, why not we bring it forward? And it's a long journey. They have their own story, how they came this far, but they've come together to put a team, and the management of Port Moresby General Hospital has been very, very supportive under the leadership of Dr. Paki Bolumi and Director Medical Service, Dr. Connie Sobi, Sister Marilyn Nicholas, and Director Corporate Service. So they've worked together to bring this. And, we don't want to see people coming into the ward and when they reach, kidney disease has stages, 5 stages. When it comes to the last stage, it's end stage. After they get hemodialysis, what do? That's the end. In Papua New Guinea, that's the end. And we need to plan a new service that will help them to go back to their normal life.
life, to be productive, go back and live. Like, for example, I know you're going back to do lawyer work, a journalist going back, a nurse going back. So kidney transplant is the last resort that for therapy that kidney disease patient resort to when they've reached that stage where we say end stage. And it's very, very important that we offer here, because if you just look around the country itself, kidney disease is on rise. Every province is now they are setting up facilities for hemodialysis in Mendi, referral, and all that. But the exit plan for all the patients, it should be kidney transplant, and it's a very, very joyful moment to see that I've taken part of that to give this service and did the first one in country.
My name is Damien Hassel. I'm a urologist with special interest in kidney transplant and vascular access for hemodialysis. I've been working at Comgen since 2016, and I've been involved in providing surgical services, particularly focusing on improving outcomes for patients diagnosed with chronic kidney disease. I think the most important development or change that happened was that we were able to successfully conduct the first 2 kidney transplants in May 14 this year. And after 3 months, the patients are doing really well, and it was a milestone for Papua New Guinea. For me as a transplant surgeon, and being able to perform the first kidney transplant in Papua New Guinea, it was a historical milestone, and also it gave hope to Papua New Guineans in that they are able to see that they are able to perform, something for the country. They are able to do something for the country instead of asking the country to do something for them. So doing the first kidney transplant in Papua New Guinea was a very important milestone. Challenges that I've learned include the limited finance, access to immunosuppressive drugs, surgical equipment, and human resource. However, we found out that collaboration with our government and international partners, like as I mentioned earlier, Transplant Links in UK and other partners, we are able to develop a sustainable kidney transplant program in Papua New Guinea. I envision that in the next 50 years, Comgen will be a leader in organ transplantation. With support from the government and our international partners, we are able to develop a sustainable organ transplantation program in Papua New Guinea.
Osana, you make out of Islam mark now. Big plan making. Organism thing possible. Long plan waiting coming out now.
How much years? How much years?
3 years now. Install dialysis master. Long plan time. Now I'm big money at your road. All white money. A long way out.
Thank you, Strang. You have much look at you now. You sit down to talk. You make history of some first floor of country lumen of the transplant.
Thank you.
Nami have much of beginning Galen. Big niche for you. So I was having to talk yes by heart. So every talk yes now saying come up with some agent logot talk yes and I'm saving you more look at some. Well done on her and yourself. We're privileged to see you in talking and good spirit is acknowledging God, the giver of life.
Yes.
Well done, well done.
Cisco Takura. One kind of thing, big man, I'm coming to my house. No saving you, me, a man married. I'm giving life long on top. And Gele, I'm giving life long on me, helping me in a salute. So that we can establish the time. Kidney disease is a silent killer. Plant the life of my ego. So, churches plus libro Islam Masenia, and you are talking about 500 kina per treatment.
That's 3 times a week, so that's
3 times a week, so
1,500.
1,500. A villager from the village got kidney disease. How embarrassing is the 1,500
a week?
A week. So one the request from me, long Prime Minister, you got money subsidizing this la fee, so that villages can afford to. We can save lives.
Cancer is the second leading cause of deaths at Port Moresby General Hospital. Dr. Peter Olali shares his experiences and insights to all forms of cancer and how cancer was managed in the past years.
Hello everyone, my name is Dr. Peter Olali. I am a specialist medical doctor, specializing in internal medicine. Internal medicine is a specialist where we deal with diseases inside the body, so that's why it's called internal medicine. So diseases inside the body can be either lifestyle diseases or infectious diseases that gets you. We deal with cancer. So cancer is not like a one-man doctor that will be able to fix cancer. Cancer requires a lot of other doctors as well to be involved in it. So when a patient comes in, as any patient coming suspected cancer coming in, first is we have to diagnose the cancer. So for us to diagnose it, we send them to the surgeon to do a biopsy, and that biopsy gets sent to a pathologist. So that pathologist now, they're like our eyes. They look at the specimen and they tell us this is the cancer that this patient has. That's where they give us the first lead. So once the results come back, we start planning the treatment. So every cancer has got different treatment modalities. Not all the cancers have the same treatment modalities. So based on whatever pathologists tell us, that's when we plan the treatment. So it's not like guess or this is a cancer, so we just guess and give this treatment. We can't guess. We have to be definite on which treatment plan we need to give to. That's why our pathologists are very, very important people to us. They are our eyes. Without them, we'll be blind. Cancer, prior to us focusing on trying to manage cancer, previously it was fragmented. So nobody wanted to take hold of cancer. Nobody wanted to be someone that will manage cancer. So 2008, when I came in transferring from Lane, we started the first oncology department under Unit 4 of Internal Medicine. So before that, everyone that had cancer and came, the surgeons will only remove your breast. After that, what else? There's nothing. You can't. There was no other place that you can go and get treatment. You have to come back and get chemotherapy. Prior to that, before 2008, we never had that. So mothers were being operated on, other cancer patients were being operated on, and that's it. How they went, we don't know where they went to. So we started from 2008, a chemotherapy ward. So since then there was no direction for everyone. So when they operated on them already, they said, okay, you go up to that clinic. So that's when we started seeing them. So it was a small center, ward up in Ward 3B, right on the top floor of the Port Moresby General Hospital. So we started from there. I was the only one there, one man with my 3 nurses that we worked at that time. So we offered the choice of giving chemotherapy to patients. What motivated me to keep on working was, patients coming in and we see them getting cured from cancer. There had been big lumps in the neck, whatever. Once you get in the first chemo, disappeared, and we saw the smiles. So that was what motivated us. The nurses doing the chemotherapy based on hands-on experience. So at least we gave some hope for the patients. They came in, they got treated. We had a lot of survivors. So since then, until 2017, the discussion started on building a cancer center for the hospital itself. So it was only discussions, talk that we were talking about it until 2019, when the government started the first funding to kickstart the feasibility studies and the first groundworks for the cancer center that we're going to have very soon, comprehensive cancer center, which will cover everything, radiation treatment, to chemotherapy, to surgery, to diagnostics. So we have come from that and to seeing something happening in front of us. So very soon this year, the center will be open. Where we started from, small space, really nothing there, and me just walking into the new cancer center, looking at how the construction is going on, it will be like a hotel. When the patient walks in there, they're thinking they're coming into a hotel, but it's a hospital they will be coming in to get treated for cancer. So we have come a long way to be where we are now. Since I came into work from there. You can see we have got only 1, 2, 3, 4, 5 chemotherapy beds. The patients always come in and exchange. So these ones will get theirs, they'll go out, and then the new ones will come in, they'll get theirs and they'll go out. So it's a daycare treatment center. So everybody comes in from home just to come in, get the treatment on the scheduled dates, and they go back home, and new ones come in. So on a daily basis they come in. We never had this kind of thing before. When we started the cancer center, not center, but the cancer treatment clinic, 2008 at that time, then this one started. So these beds were from upstairs, then we moved them down. You can see that it's only 5 beds. With the new cancer center coming up, we will have 15 beds. So we'll increase the number, 10 more extra beds coming in. The numbers that we see now, that's coming in on a regular daily basis, is really significantly increased. So human resources as well is another thing to sustain that as well. So, coming from that time until now and seeing the progress of health and all that, we came a long way. What we are doing now for cancer is we are laying a foundation. For the first time, we started from ground zero and we're coming. We are doing it first in our region, Pacific region, outside of Australia, New Zealand. We have a hospital that's doing this now. From ground zero, we are building a state-of-the-art cancer center that you will find anywhere else if you go to Manila, Singapore, Australia. That's what we are doing now. But we started from ground zero, from scratch, and at least we are doing something now. We are laying a foundation. 50 years from now, I know there'll be totally something different happening. The young generation that's going to be coming up, they will move on from what we've laid down.
With all these new and exciting milestones, Port Moresby General Hospital's Cancer Services is looking towards a brighter future. The new comprehensive cancer center will bring hope and life transformation to Papua New Guineans diagnosed with all forms of cancer. Today, Port Moresby General Hospital is led by the highly skilled and well-respected Chief Executive Officer, Dr. Paki Molumi, who oversees all departments, specialized care units, and administration. He shares his experiences, the challenges, and gives us new exciting information on Port Moresby General Hospital's latest facilities and future plans.
One of the things that I saw when I was during my clinical days as an ENT surgeon was that not much development was happening here. During that time, I was so thankful that late Theo Constantino's board came in, and then Grant Medal as the CEO at that time. We did a complete refurbishment of the Walter Throne, the Ward 2C that you see, Ward 3. Those wards were not like that. They were completely run down. The bathrooms were really bad. But that's one of the major infrastructure upgrade that I saw during my time as a ENT surgeon, as a doctor practicing in the wards. Yeah, so one of the things, as I've said in my practice, was trying to become another referral doctor again. The country expects Port Moresby General Hospital to provide the high-end specialist care, but then we refer them to overseas again, or those who can afford. Yeah, so those was the biggest challenge that I saw in my practice as an ENT surgeon. And then I thought, we should change this trend. And one of the projects that we started is the Cancer Center project. So we look at our numbers, what is really the high morbidity and mortality, meaning that the high number of admissions and deaths at our hospital. So The common causes of deaths and admission in our hospitals are in heart and stroke. In fact, stroke is the number one, then followed by cancer, and then chronic kidney disease. So those are the three common leading causes of admissions and deaths in the lifestyle disease category. Of course, we have the traditional TB, malaria, but Port Moresby General Hospital is as a specialist hospital providing high-end care is in the lifestyle disease. So we targeted, when I took the office, to address the heart and stroke, the cancer and the kidney disease. So in the heart disease, of course, before I came into the office, we were just starting to build up the cath lab services. But thanks to Kumul Petroleum Holdings, with their support of 50 million over 5 years through the tripartite MOU, we were able to build the cardiac services. So we started with the non-invasive cardiac services, which is the ECG, the echo, the treadmills. So it's equipped with some of the high-end technology in the non-invasive in the cardiac clinic. Then the invasive to the cath lab, where we are able to do stentings and angiograms. So I think as far as cardiac service is concerned, we have come to that. Now the next target we are looking at is the cardiac surgery, which is going to complement the cardiac program. Cardiac surgery has come a very long way through the Operation Open Heart program over the last 25-30 years. With the same infrastructure we have. Now we have advanced into providing the adult cardiac surgery. Now we are doing the cardiac bypass surgery now. But in an infrastructure that is not conducive or that doesn't meet the standards of cardiac theater. So our next plan moving forward as far as cardiac is concerned is to have a standalone cardiac theater so that we can provide the entire cardiac service from non-invasive cardiac services to the invasive in the cath lab, which is already at an advanced stage now, and then to the cardiac surgery, which so that we can be able to continue doing the congenital heart disease, support the Operation Open Heart program, and also do the adult cardiac bypass surgery to complement the cath lab, because once someone has got a complex issue in the cath lab where it cannot be addressed through the stenting, it's got to have bypass surgery. So we've got to have that cardiac infrastructure, and that is our plan for this year, 2025 and 2026, so that will complete the entire standalone cardiac program. And what we want to see for the country after 50 years is that this program must be owned by Papua New Guineans, and we have to have our Papua New Guineans trained to do this type of surgery. We cannot continue to depend on volunteers, which we have been doing over the last 25 to 30 years. Now it's time that our own team have to do these procedures ourselves so that we have a sustainable heart program for the country. So that's in addressing heart and stroke. In the stroke, we have trained, put a team together, stroke committee. We have trained the personnel now. Now we are moving towards establishing a stroke reversal program for the country. The next one is the cancer. Cancer is really for me, is going back to my 11 years as a ENT surgeon, referring these cancer patients, asking them to raise money, go to Singapore, Philippines. It's really been a challenge for me to see people, who cannot afford and just say, I have to go home, because trying to raise 50, 60,000 Guinea is just too much. Yeah, so we've been pressing on the cancer center, and because of funding constraints, because the cancer construction is done in a way that we we issue contracts and continue to meet the annual government funding. It's not a bulk funding. Therefore, it has taken some time, but now we've come to a stage where the bunkers are complete. Soon the equipments will be installed. Two of the latest linear accelerators, Alcyon and a TrueBeam. We'll have the brachytherapy unit, which is for cervical cancer treatment and esophageal cancers. We'll have a modern chemotherapy unit. And you can give all these treatments through radiotherapy and chemotherapy, but how will you know that the cancer is responding to the treatment? Therefore, you will have to see how the cancer cells at the molecular level are responding to your treatment. And that's why we need to have a nuclear medicine department with a PET scan. So that is also part of this program. So we will be having one of the latest United PET scan machines being installed so that we can have a complete radiotherapy service. Not only that, we are putting another 2 floors on top of this current cancer center. Now your construction you have seen, the foundations are going in place to put the upper 2 floors, where we will put a radioiodine treatment facility, for thyroid cancers. Those are cancers that cannot be treated by the radiotherapy and the brachytherapy or chemotherapy on the bottom floor. So that service will be offered on the top floor with immunotherapy and the bone marrow transplant for leukemias. And with a tumor board and a cancer registry and cancer research lab, that completes a comprehensive one-stop shop cancer facility. So we expect to open the first of the, with 1 linear accelerator, the brachytherapy unit, and the chemotherapy in March 2026, and the rest will follow from towards the end of 2026, 27, 28. So we will spread out the program depending on the human resource availability and the consumables and so forth. Yeah, so that's the cancer program, which is the second common cause of deaths and admissions at the hospital. The third one is the kidney, chronic kidney disease due to hypertension, diabetes. So thanks to, we partner with National Fisheries Authority and over the kidney transplant program. Many PHAs are putting in installing dialysis machines. So what will have to be the dialysis machine that you're going to keep someone alive and hooked up to that machine with 3 sessions of dialysis per week. 3 sessions per week to someone who's got chronic kidney disease. So which means this person has to stay close to where our mission is. You cannot travel far, you can't go out doing business because you are already hooked up to the machine. So each of those PHs installing the dialysis machines, including PMGH, we must make sure that the machines are working, reverse osmosis plant is functional, consumables are available, because you are keeping someone alive. You don't have those working and you want to close down the service, you are actually hooking up these patients from their lifeline. So that is the biggest challenge that each of the PHAs will have. I think since 2014, the Kidney Foundation have been providing that service. So we have now partnered with Kidney Foundation to provide the dialysis service. Now, Port Moresby General Hospital, that's the level 6 tertiary hospital. We have to get these patients out of the machine. That is through the kidney transplant program. Yes. So we've started that in May this year, 2025, on 14th and 15th of May. We've offered 2 kidney transplant to 2 patients. Now these 2 patients, they have moved out of the machine. In fact, they've returned back to work. So someone who has been living an uneconomical life, been hooked up to the machine, is now living an economical life, contributing to the country. So that's how impact the kidney transplant program will have. So we are offering that to the country. So as we celebrate 50 years of independence, we've offered a heart program
a kidney program, and we'll be offering a cancer program for the country here.
Due to these massive milestones, Port Moresby General Hospital has changed many Papua New Guineans' lives. And with such major improvements and future plans, it's not hard to feel quite enthusiastic about the future and the immense help they could give to the citizens of this nation. Today, Port Moresby General Hospital and its hard-working staff look forward to the future. Amongst the many challenges, it continues to persevere in the hope of bringing quality healthcare for people who are in need every single day. No matter the hardships, they are committed to providing healthcare to the people of this nation, today, tomorrow, and into the future.